And welcome back. Well, anyone who's tried to take off weight knows that the hardest place to lose it is the abdominal area.
Yeah, our next guest knows that all too well. So she chose to have a tummy tuck. And joining us now to talk about it is Kathy Frisch, along with Dr. Paul Lowenstein, who's a member of the Greater Milwaukee Plastic Surgeons. Nice to have both of you here.
Yeah,
Thanks
you.
so much.
Thank you.
I think it's the kind of procedure that women, especially if you've had kids, but even if you haven't, talk about all the time and kind of dream about. And you had it done.
Yes, I did.
How did it go? Are you happy with the results?
I am ecstatic.
You
yes,
are?
Yes, I'm
What-
so glad I had it done.
How did
So-
it make you, how were you feeling before you had the surgery that kind of made you start to really think about it and then seriously consider it?
Well, I've thought about it for many years, but things just constantly got in the way, and I was always putting priorities over wants, you know. And it almost got to a point where my self-esteem was also going down, and I think my family could see that. And then we're all talking one day, and it's like, let's go and have a consult and see what can be done, and if you're a good surgical candidate, which I did meet with Dr. Lowenstein, and I was a surgical candidate for that, which brought my hope up a little bit closer to
To reality.
it maybe being a reality. Yeah.
I
Great.
think so many people have body folds that they don't, they don't like or love about themselves, and we often find ourselves covering up or wearing certain things to hide those areas, when really it would be so nice to feel more confident about them. I know we've got some very great pictures. They are medically a little bit graphic, but they're fantastic to show how different the before and after is. That's amazing. This before and after. Is this you?
Yes, it is.
Wow.
I give
That's
you,
extreme.
And I give you a lot of credit for like agreeing to share the pictures with us. The results are
Amazing.
so dramatic. What about the recovery? What was that like for you?
You know, it wasn't bad at all. The pain wasn't bad. I took the recommended pain pills on schedule for the first couple days, 2 to 3 days. After that, I just went to Tylenol as
Wow.
needed, pretty much.
Okay.
You know, you're always going to have some numbness until you're completely healed, but for right now, it's not bad at all.
And how
I
long
feel
was
great.
it before you were back to regular activities, walking around, doing things?
Probably just a couple weeks.
Yeah, that's
You know, I've always tried to keep active even during that time, but if I overdid it, I definitely had to take an extra Tylenol or so, you know.
yeah. And you would do it again.
But yes, I would.
That's right. Dr.
Yes.
Lowenstein, I bet you see a lot of patients like Kathy who are starting to see that their image of their body starts to affect their self-esteem.
Well, yes, and what's more, especially if a woman's had a few pregnancies, they feel like, well, if I just work out or if I just lose the weight, it'll be all better, and it isn't always. They work out till they're blue in the face, but the stretched out skin, the stretched out muscles, they don't come back, and so it gets to be frustrating, and they think, well, what's wrong with me? But everybody's the same. There's only so much you can do.
How do you know on a patient when you're meeting with them whether something like liposuction or something more like surgery is a better fit for their body fold?
Well, that's a good question. Liposuction is good for what we call figure faults. Maybe a little bulge over the saddlebag area, a little bulge over the lower abdomen. It doesn't cure loose, lax, redundant skin.
Okay.
And as plastic surgeons, we're trained in all aspects of body contouring, and we have all the tools at our disposal. And so we're equipped to say to a person, well, yeah, liposuction will work for you, or it won't work for you. You need a tummy tuck, or maybe you need a combination.
And in these pictures, we're looking at before and after of liposuction, correct?
Correct.
So this is not surgery. This is liposuction
This
where you're
is-
removing fat.
Just through little incisions, tiny incisions, you literally suck the fat out.
Okay. What should people be aware of if they're thinking about having this done or they've always wanted to do this?
Well, I think they have to realize that a tummy tuck is major surgery, and there are potential complications, potential side effects. One of the most serious would be something like a blood clot in the leg that could flip off and go to your lung, and that could even be lethal. So there are things we do to prevent that. And we also have to, as physicians, assess whether a person is a reasonable risk. And if they're too high a risk, then we'll just tell them that you shouldn't have it done.
And when we talked to Kathy, you said, some of the pain was there. Yes, there is a recovery period. How would you say the pain is on average for people, doctor?
Well, there's some things we do. We have a liberal use of local anesthetics that we inject in the muscle where we repair the muscle and the skin. And so that helps quite a bit. Try to use non-narcotic pain relievers if possible, so that they don't have nausea and vomiting. But ultimately, narcotics are the best pain relievers. Early ambulation. We used to, when I was in training, keep people in bed for a few days, and that increases the risk of the blood clots forming. So we encourage early ambulation. And I think that psychologically and physically gets the patients recovering faster.
Really quickly, doctor, what do patients say to you after they've had this procedure and they get a few days or a few weeks out and they have kind of like a new tummy?
Well, as Kathy said, they're ecstatic.
Yeah.
But you do have to be patient. Sometimes you'll have swelling and you have to wait for that to go down. The muscle work that we do, there's no way that a person can simulate that through exercise and getting back the hourglass figure and being able to wear, I've had patients tell me, I never thought I'd wear a bikini again, or I never thought I'd wear a two-piece again. And lo and behold, they start doing it.
Yeah.
That's great. Good for you,
Yeah, you look
Kathy.
amazing.
Thank you.
Yeah, you do.
I want to make sure everybody has the information for Dr. Lowenstein so that you can call and have a consultation or ask any questions that you may have about anything that you have that you're interested in. They're located on North Avenue in Brookfield. The phone number is 262-717-4000 or visit drlowenstein.com. And you can revisit this segment on our website later to get the correct spelling as well. Thanks so much, and fantastic before and afters.
Yeah, thanks to both of you.
Kathy.
Coming up on this show, a Vietnam veteran tells us about his mission to make it a Merry Christmas for other vets and how you can help too.
And next, what are you going to do while the guys are off hunting? After the break, great ways to get a little girl time when we come back.